Hi, my name is Jenna Henderson, and I'm going to be presenting on the correlation between forward and backward treadmill walking in school-age children. Backward walking is described in the literature as being a time reversal of forward walking, suggesting that the two gait patterns may be driven by a similar neural mechanism. High correlations in joint kinematics between forward and time-reversed backward walking have been reported in both adults and school-age children. However, most literature examining this has focused on overground walking. It's well established that there are significant differences between overground and treadmill walking patterns, yet despite the frequent use of backward treadmill walking in a clinical setting, responses to changes in walking direction on a treadmill are not well studied. Therefore, the purpose of our study was to investigate the correlations between forward and backward walking kinematics in typically developing school-age children during treadmill walking at different speeds. We hypothesized that all variables would be highly correlated between forward walking and time-reversed backward walking at all speeds. We recruited 19 typically developing children between the ages of 6 and 12 and had them complete 6 2-minute bouts of treadmill walking, so that was forward and backward at 3 different speeds each. We collected kinematic and EMG data and then calculated correlations between forward and time-reversed backward walking for all variables. So the table here on the left shows the coefficient of determination between forward and time-reversed backward walking at all speeds, and then the graphs on the right illustrate those findings and the normal speed condition. As you can see here, the kinematics at the hip and at the knee are very similar for forward and time-reversed backward walking, and this is supported by our R-square values, which are quite high with minimal variability. Our vertical ground reaction forces were also fairly highly correlated in the normal speed conditions, with the correlations decreasing at the faster speed, which is similar to what we see in adult literature. At the ankle, however, some differences emerge. As you can see in the graph, our ankle kinematics are very dissimilar between the forward and time-reversed backward walking conditions, and this is supported by very low R-squared values with high variability, high standard deviations. We also found that children adapted to backward walking differently than what's reported in the adult literature, limiting their ankle range of motion and by using their ankle plantar flexors less. So these findings are in line with the poor correlations that we see at the ankle between these two walking conditions. So what we found is that school-age children tend to adapt their ankle motion quite differently than adults during backward walking on a treadmill. We suggest, therefore, that proximal control at the hip and knee may be mature by this age, but distal control at the ankle is still lacking. Perhaps the neural control for backward walking is still developing in school-age children, but only becomes apparent when they're challenged to walk on a moving treadmill belt instead of overground. This is in line with some previous literature that found some aspects of treadmill gait are continuing to mature into adolescence. A limitation of our study is our relatively small sample size with a large age range, which prohibited us from being able to determine if neural control at the ankle is maturing between the ages of 6 and 12. Further research examining exactly when this control matures is still needed. Thank you for listening, and if you have any questions or comments, please feel free to reach out using the contact information presented here.